Good morning to all. Myself Manisha Bagan and today's my presentation is hydatidiform molar means molar pregnancy. So first introduction. It is a rare mass growth that form inside the womb, the beginning of a pregnancy. It is rare मतलब मास का ग्रोथ हो जाता है इनसाइड द वॉम्ब यूट्रस में बिगिनिंग्स ऑफ मतलब प्रेगनेंसी के टाइम्स पर. It is also known as molar pregnancy and vesicular molar. This is normal uterus and this is molar pregnancies. Definition. It is an abnormal condition of placenta where there are partly degenerative and proliferative changes in the chorionic villi and the result in the formation of cluster of small cyst of varying size. Causes. As a or molar pregnancy result from abnormal fertilization of the oocyte egg. It results in abnormal fetus. The placenta growth normally with little or no growth of the fetus tissue. The placenta tissue form a mass in the uterus or ultrasound. This mass often has a grape-like appearance as it contains many small cysts. Chance of molar formation is higher in older women. History of molar in early years is also a risk factor. This is normal placenta and hydatidiform molar. Types. Two types of hydatidiform molar. Mole. Complete hydatidiform mole and incomplete or partial hydatidiform mole. Firstly, complete. It is a placental tissue is abnormal swollen and appear to form a fluid filled cyst and other. There also no formation is fetal tissue. Fetus absent and uterine size more than the date. कंप्लीट में क्या होता है, इसमें एबनॉर्मल स्वॉलन हो जाता है और एमनियोटिक फ्लूइड मतलब फ्लूइड होता है वो फिल हो जाता है सिस्टे के रूप में और इसमें फीटस एब्सेंट रहेगा एंड यूट्राइन साइज मोर देन हो जाएगा डेट के अकॉर्डिंग. टाइप्स ऑफ मोलर प्रेगनेंसी. मोलर प्रेगनेंसी कैन बी टू टाइप्स. partial molar pregnancy, complete molar pregnancy. And partial molar pregnancy, there is an abnormal placenta and some fetal development. इसमें प्लेसेंटा एबनॉर्मल रहेगा और सम फिटल डेवलपमेंट मतलब फिटल का कुछ फिटल्स का डेवलपमेंट होगा. कंप्लीट मोलर प्रेगनेंसी में देर इज एबनॉर्मल प्लेसेंटा एंड नो फिटस. कंप्लीट मोलर प्रेगनेंसी में क्या होता है, एबनॉर्मल रहता है प्लेसेंटा बट फिटस नहीं रहता है. देर इज नो वे टू प्रिवेंट फॉर्मेशन ऑफ दिस मासेस. partial hydatidiform molar may be normal placenta tissue along with normally forming placenta tissue. There also be formation of a fetus but the fetus is not able to survive. Fetus is present, uterine size less than the date. इसमें एबनॉर्मली फॉर्मेशन होगा फीटल टिश्यूज़ का और इसमें फिटस एबल मतलब सर्वाइव नहीं कर पाएगा. फिटस प्रेजेंट रहेगा बट सर्वाइव नहीं कर पाएगा और यूट्राइन का साइज़ लेस देन होगा उसकी डेट के अकॉर्डिंग उसका साइज़ लेस देन होगा. एटियोलॉजी. मैटरनल एज, प्रीवियस मोलर प्रेगनेंसी, न्यूट्रिशन एंड सिटोजेनिक एबनॉर्मलिटीज़. एटियोलॉजी में क्या मैटरनल एज 30 के अबाव या 40 या फिर प्रीवियस अगर कोई प्रीवियस हिस्ट्री रही हो मोलर प्रेगनेंसी की. न्यूट्रिशन, माल न्यूट्रिशन या सिस्टोजेनिक एबनॉर्मलिटीज़ रही हो. साइन एंड सिम्टम्स. डार्क ब्राउन टू ब्राइट रेड वेजाइनल ब्लीडिंग ड्यूरिंग फर्स्ट ट्राइमेस्टर. फर्स्ट ट्राइमेस्टर में डार्क ब्राउन या रेड ब्राइट रेड कलर की वेजाइनल ब्लीडिंग होगी. Sometimes Galatians fluid also present due to rupture cyst. Severe nausea and vomiting. Severe होगा nausea and vomiting. Sometimes vaginal passes of grapes like cyst. Sometimes vaginal में से secretion होगा grapes like cyst का. pelvic pressure और पेन होगा एकदम सीवियर टाइप का. pelvic pressure होगा प्रेशराइज होगा. अदर साइंस रेपिड यूट्राइन ग्रोथ, प्री एक्लेम्सिया और एनीमिया. सिम्टम्स ऑफ मलर प्रेगनेंसी में इंक्लूड abnormal growth of uterus, either bigger or smaller than usual, severe nausea and vomiting, vaginal bleeding during the first 3 months of pregnancy. Symptoms of hyperthyroidism include heart intolerance, loose stool, rapid heart rate, restlessness or nervousness, warm and moist skin, trembling hand or unexplained weight loss. And symptoms similar to preeclampsia that occurs in the first trimester or early second trimester include high blood pressure and swelling in the feet, ankles and legs. This is almost always a sign of a hydatidiform mole. Become preeclampsia is extremely rare. This is early in the normal pregnancy. Diagnostic test: history collection and physical examination, CBC, ABO, RSO grouping, sonography, X-ray, histological examination, urine test, SCG value increase more than 1 lakh, CT scan and MRI. Then exams and tests. Your health care provider will perform a pelvic exam which may show signs similar to a normal pregnancy. However, the size of the womb may be abnormal and there may be no heart sound from the baby. Also, there may be some vaginal bleeding. A pregnancy ultrasound will show a snowstorm appearance with an abnormal placenta, with or without some development of a baby. Tests done may include SCG quantitative level blood test, abnormal or vaginal ultrasound of the pelvic, chest X-ray, CT or MRI of the abdomen, and complete blood count, blood clotting test, kidney and liver function test. Management: supportive management, IV infusion, blood transfusion, antibiotic is given and blood is kept revised. Definitive management: suction evolution. It is safe, rapid and effective in almost all cases and is done even when the uterus is of 28 weeks gestation. Cervix favorable or group A molar is in process of expulsion. Cervix unfavorable or group B, a uterus remains insert. This is a speculum is a place in the vaginal. A tentaculum is clamped to the lip of the cervix and the cannula inserted into the uterus. This is picture shows. And B, the amniotic fluid placenta and fetus are suctioned through the cannula into the collection jar. The fetus and placenta are formed apart in the process. Then management: hysterectomy and curettage following vaginal evacuation. Hysterectomy. Hysterectomy, surgery to remove the uterus, may be an option for older women who do not wish become pregnant in the future. After treatment, your SCG level will be followed. It is important to avoid another pregnancy and to use a reliable contraceptive contraceptive for 6 to 12 months after treatment for a molar pregnancy. This time allow for accurate testing to be sure that the abnormal tissues does not grow back. Women who get pregnant too soon after molar pregnancy are at high risk having another molar pregnancy. Then treatment. If your provider suspected a molar pregnancy, removed of all abnormal tissues with a dilation and curettage will most likely be suggested. DNC may also be done using suction. This is called suction aspiration. The method uses a suction cup to remove the content from the uterus. Sometimes a partial molar pregnancy can continue. A woman may choose to continue her pregnancy in the hope of having a successful birth and delivery. However, these are very high risk pregnancy. Risk may include bleeding, problems with blood pressure, and premature delivery. In rare case, the fetus is genetically normal. Women need to completely discuss the risk with their providers before continue the pregnancy. Follow up. Inquire about relevant symptoms, abdomino-vaginal examination, investigation, contraceptive advice, complication, hemorrhage, sepsis, perforate uterus, and preeclampsia. Thank you.